My name is Thomas Alexander. I work in the Division of Pediatric Hematology and Oncology. I focus primarily on pediatric leukemia and lymphoma from a clinical and a research perspective. And I actually did not grow up thinking that I wanted to be a physician at all. My plan was to be a coach and a teacher. And then it was pretty late that I transitioned over into medicine. And in medicine, I wanted to do everything. And so I did medicine and pediatrics training and residency. And then it was late there that I decided to go into pediatric oncology. So in a way, I'm a bit of a late bloomer coming to that. But it was very clear that once I spent time with the patients that I got to know during residency, dealing with oncology, that's where I wanted to spend my life. And I think it was quite clear that within that age group, I think there's special times with teenagers, with the younger kids, middle age, but for me, that age 2 to 7 year old kid that still firmly lives within the magical, imaginary realm, in addition to understanding reality and not necessarily seeing a contradiction between the two, but that can be in both of those places at once, I think is a window into something incredibly special. So with that age group, kind of continues to bring energy to me, and that's where the biggest concentration of patients with acute leukemia are. With pediatric patients especially, it clearly is a team environment, and multidisciplinary teams are critical throughout cancer, but by definition of pediatric patients, it involves parents, directly involves siblings. We have, in some ways, more of a need for really important other services, school program, child life services, psychologists, to support the patient and the parents and the family. And so I think welcoming everybody to the table, both with the patient and their family, and then the other critical services, and recognizing that in some ways I'm one of the coaches of the team, or maybe the quarterback of the team, but really none of the excellent work gets done unless we involve everybody and their important role on the team. And so kind of trying to set the stage, but then get out of the way to let the specific expertise in each area come in and surround the child and the family with the right kind of medical care and support services they need. A lot of my training over the past 10 or 15 years, I've made decisions so that I can be in an opportunity to be in a place right now where I can work with families and feel confident and know that I am able to provide the best care that is available. And that's whether it's routine care or on a clinical trial or through compassionate use of medications not even available on a clinical trial. Through training and relationships and my research, I think I'm able to provide that for children with high-risk leukemia and high-risk lymphoma.